So we just talked about preload, and we talked about afterload. So I want to just kind of explain, actually we just talked about preload. So I want to explain with the preload about with the rubber band. So remember, preload is basically you're loading up the ventricles with blood. And again, we're mainly going to talk about the left ventricle because the left ventricle gets all the glory because it's pumping the blood out to the rest of the body. But both ventricles are being loaded up with the blood. So preload is during diastole, as the ventricles are filling with that blood. And we talked about the Frank-Starling law: the greater the stretch, the more powerful the force of contraction. And you can use that concept with the rubber band. So if you take a rubber band and you really kind of pull it back, the further you pull it back and then you go to let it go, the further it's going to fly. And it pretty much almost hit that wall there, if you didn't quite see that. But if you don't pull back as far, then it's not going to go as far, right? And same concept with preload. The more you load up that ventricle with blood, the more it stretches and fills with blood, then the more powerful that force of contraction is going to be, and the more that's going to be ejected out, or you're going to increase that stroke volume or increase that cardiac output. Now this is under normal physiologic conditions. So you've got a normal, healthy ventricle that's able to stretch well and then recoil well as it pumps the blood out. But there's things that can happen that can change that ventricle that could certainly affect its ability to pump and for good cardiac output. So let's say over a lifetime we've been really stretching that rubber band. Stretch, recoil, stretch, recoil, stretch, recoil, stretch, recoil. What starts to happen to that rubber band? What starts to happen to that elasticity? Yeah, it starts to lose that elasticity. So when you start to lose that elasticity, the same thing happens to the stretch fibers and the muscle fibers of the heart. It starts to lose that elasticity. So then when you start to lose that elasticity, when you stretch it and it goes to recoil, it's not going to recoil as much because it's lost that elasticity. And you're going to have decreased stroke volume, decreased cardiac output, and the heart's not going to be able to pump as well. You're not going to have that Frank-Starling law or that increased force of contraction happening. Now, some things that can affect that, age can affect that. So when we start to, right now we're just explaining normal concepts, but when we talk about heart failure, the majority of cases of heart failure, about 85% of cases of heart failure are related to old age. So mostly people that are older that you see them with heart failure. Also, hypertension, the heart having to really work hard to pump blood out into a system where it's more constricted. That can cause the ventricles to overstretch, and overstretch over time they start to lose its elasticity. If someone has a damaged area in the ventricles, let's say from long-standing coronary artery disease, ischemia, they've had an MI, and they have a damaged area, that area would have lost its elasticity or no longer has elasticity, and that's going to affect its ability to stretch and fill with blood, and then it's going to overall affect its ability when it pumps blood. So that's preload. And then the other one is afterload, and I'm going to use the door here to explain afterload. Now afterload, preload is during diastole, you're loading up the ventricles with blood, and it's basically how well those ventricles can really stretch and fill with blood so that they can have a nice powerful contraction to pump the blood out. Afterload is when the blood is actually being pumped out. So you can think of it as the heart is offloading the blood, or it's pumping the blood. So preload is it's stretching and filling with blood, and Frank-Starling law, the greater the stretch, the better more forceful the contraction. Afterload is it's offloading the blood. The door is going to be the aortic valves as it opens up, and I'm the left ventricle. So on the left ventricle, I pump the blood, and as the left ventricle pumps, it's the force or the pressure that it meets, or how forceful it has to contract to open up that aortic valve in order to pump the blood out into the aorta and out to the rest of the system. And that's the afterload. It's the pressure or the amount of resistance that the left ventricle meets, or how forceful it has to pump that blood out in order to open up that aortic valve and pump the blood out into the rest of the system. So what do you think are some things that could affect afterload? Yeah, so we talked about hypertension. Hypertension can indirectly affect preload. that when the heart has to work really hard to pump out blood, it can lose its stretch over time. Hypertension can directly affect afterload. So think about out here, arterially, your aorta and the rest of your arteries are more constricted. That left ventricle is going to have to pump harder, and it's going to meet a lot more resistance, and as it opens up the aortic valve to pump blood out into a system that's more constricted. That would definitely increase the afterload. So if someone had hypertension, that left ventricle is going to have to pump harder, it's going to meet more resistance as it opens up that aortic valve to pump out blood out into a system that's more constricted. What are some other things that could maybe cause the left ventricle to meet more resistance, or it could increase its afterload? Yeah. If this aortic valve is stiff or stenotic, we call that aortic valve stenosis. As people get older, calcium and collagen can develop inside that aortic valve, and so it's going to be more stiff and stenotic. It's not going to stretch as well, and basically that left ventricle has to work harder to pop open the aortic valve when it's more stiff or stenotic. If you have plaque that's developing out in your arteries, then that's going to cause increased resistance, where that left ventricle has to work harder to pump blood out to a system where there's narrowed areas because of plaque developing. But under normal conditions, the left ventricle is going to basically encounter a normal amount of resistance, and overall afterload is the amount of resistance that the left ventricle encounters as it pumps to open up the aortic valve to pump blood out into the system. But when we start looking at hypertension, and when we look at heart failure and peripheral arterial disease, coronary artery disease, you'll see how that can affect the afterload. And that's it.